Hi, I'm Dr. Patrick. I'm one of the GPs from Kilmeny Surgery. This is just a video to discuss a bit about some of the positives about breastfeeding to help ladies decide if it's something they maybe would want to try and give a go. Once baby is born, for the first 6 months, literally all they need is either breast milk or formula milk. And I think the first thing to say is whichever one you do end up doing, that is absolutely fine. And please do not at any point feel pressured or feel guilty about choosing one over the other. One of the positives about breastfeeding is that it is free. It means that you don't have to spend money and be buying formula for those six months to the first year when the baby needs non-cow's milk. So it does mean if you're breastfeeding, you're not having to spend that money on formula, just because your body is naturally producing the breast milk for however long you continue to breastfeed your baby. One of the massive positives of breastfeeding, which I feel is one of the biggest ones, is that it helps keep your baby healthy by helping protect it from getting poorly from infections. The reason for this is because whenever any of us get poorly with an infection, part of our body's response to fighting it off is that our body makes antibodies. And once the body has fought off the infection and cleared it, these antibodies stay in your body. And while your body still has those antibodies, it means if you were ever to come into contact with that same bug again in the future, it means that you wouldn't get poorly a second time from it, or a third onwards. We pass along these antibodies in our breast milk, and it means that babies have that protection from your antibodies too. So it means that if baby comes into contact with any bugs or germs that you've previously fought off, it means baby doesn't get ill from it, or they get less ill than they would have done if they didn't have your added protection from these antibodies. We do know that babies that are breastfed are admitted to hospital less often with chest infections and diarrhoea and vomiting illnesses. And babies who are breastfed also have ear infections less often as well. Another positive about breastfeeding is that it is really convenient. If you're having to make a formula feed each time, it involves sterilising a bottle and teat. It involves boiling water to sterilise the water you're going to give in the feed, and having to wait for it to cool down enough that it's safe to give baby. So if you've got a crying, unhappy baby wanting their feed, that can seem like a very long time. Whereas if you breastfeed your baby, all you need to do is pick up baby, put baby to the breast, and then the milk should flow and baby has its feed. This can be an added bonus, like if you're out and about outside the home, and also like at night. So say if you're having to get up, go downstairs to make up a feed, it just means if baby's been asleep in the Moses basket or whatnot next to your bed, that you literally just pick up baby, put baby on the breast, and it means you hardly have to kind of get up at all. In terms of some of the positives, in terms of for the mother who is breastfeeding, it does reduce the risk of breast cancer and ovarian cancer. Also, another positive for mum about breastfeeding is that breastfeeding burns 500 calories each day. So we normally find mums who are breastfeeding lose that baby weight a bit more easily and a bit faster. In terms of the legal side, the law protects breastfeeding mums, and you legally have the right to breastfeed your baby or child anywhere in public, anytime. And that's part of the Equality Act 2010 that gives you that right. Two really good people to get support and advice about breastfeeding from are your midwife and the health visitor. So it can be a good idea to speak to your midwife a bit about breastfeeding before baby comes along, and to help explain how to go about breastfeeding. And once baby's here, if you're having any difficulty with breastfeeding, finding it tricky, or it's becoming comfortable or anything like that, do discuss it with your midwife or health visitor, and they can help rectify the problem to allow you to continue breastfeeding and it be a comfortable thing. However long you decide to breastfeed is completely down to you, and even if you just breastfeed baby once, like immediately after the birth, that's in itself just been shown to be really positive and give health benefits for baby, even if you just ever feed one time. But whether you feed for 1 day, 1 week, 1 month, 1 year onwards, that's a choice that's obviously completely down to you. And as I said before, whichever one you choose to feed your baby with, whether it be formula feed or breast milk, just make sure it is the right thing, that it's your decision, it's whatever's right for you and baby and your family. And at the end of the day, whichever one you choose is fine, because the main thing your baby needs is love. Okay, bye for now.